Hello everybody, my name is Lorcan Brennan and I'm delighted to be here with you today. I'm from an organisation called the Men's Development Network, and I'm really thrilled to be here today because our own organisation has worked for many years in relation to engaging with men at many different levels. And I'm here with my team today. There's a lovely team around me of colleagues and friends who also have been very much part of being involved with men's health on the island of Ireland. I'm delighted to be here, and especially to say that I have people here from IT Carlow, from the Research Centre. I have people from the Department of Health. I have people from the HSE, and also in the background from the Men's Health Forum in Ireland. And just to say at the very beginning, I suppose that in a few moments, I will introduce the panel to you and I'll let you see who I have with me, and they'll come on and they'll wave and they'll have an introduction for later on in this webinar. This is the first in the series of 4 webinars that we're going to run with regards to engaging men with our health. And can I just say at the very beginning, I'm delighted also, you can see Catherine is there with us today, Catherine White, who's signing in Irish for us. So we have the IMS as well, who are behind us and who are minding us from a digital point of view. And hopefully all will go well for us. I'm trying to stay away from the desk here in front of me, because if I do press any buttons, I ask you please to forgive me of any blips in case I turn off the lights in Athlone. I apologize even before I start. But look, it is worth just saying at the very, very beginning that we are in the Zoom webinar format. You'll see that at the very beginning, and we will be using the questions and answers as well in relation to trying to contact us along the line. And if you want, as we go into the webinar, to do anything in relation to tweeting, we can use the hashtag, which is the Healthy Ireland Men, and you can tweet about this webinar as we go along as well. Now, we sometimes hear, especially at the moment on the island of Ireland, that there's a little bit of fatigue in relation to Zoom. But we know for a fact here today that there's so many people from so many different backgrounds who are interested in men's health, and you're all online, and you're so welcome today to be part of this, the very first, as I say, in a series of 4 webinars that will run between now and coming up to Christmas on the idea of engaging men. And today, for our first webinar, we're going to be looking at the why of men's health. And I think it's not a bad place to start. And I suppose also to say before we begin, when we're speaking about men's health on the island of Ireland, one of the good things we can say is that it's not a greenfield site, that there's a lot of progress in place already, that we have academic research, that we have a national men's health policy, that we have an action plan, and that we have many organisations who are across our country who have been really at the front line in relation to engaging and working with men in relation to our health and our lives. So we've a lot to celebrate. And it's our hope as a team here today, I suppose, that we can focus on a strengths-based approach in anything that we do, and that we'll also be hopefully creating a space where we can celebrate transforming masculinities, and especially, I suppose, to celebrate the fact that we're looking at having a conversation in relation to men's health on the island that hopefully will be a support to all of us in our work. And to begin today, the way we're going to work, as I say, I'm going to introduce to you some of our panel. And the way we're going to work today is across a very simple format. The very first thing we're going to do is we're going to have an input from somebody called Noel Richardson. I'm going to bring him up there in a few moments, not yet. And then we're going to be followed by Paul Gillen, and Paul will be up as well, and he's from out west. And then we're going to have a discussion afterwards, which would be a panel discussion in relation to why of men's health. And we hope that in some way with the panel that we're going to have for that, that would be an informed conversation and discussion that we'll have together. And we'll have Biddy there for that. But just before we go any further, can I say an introduction, an overall introduction? I'll just go back for a moment and say, Noel Richardson, can you come up there just for a moment till I say more about you, just for a moment. And Noel is, I suppose from the very beginning, he's been very much at the heart of men's health on the island of Ireland. He's part of the Research Centre in IT Carlow. He's also been involved in the very first pieces of research getting inside men's health, the National Men's Health Policy, and of course the action plan as well, that's been part of it. And Noel will be back to us in a few moments looking at the why of men's health. And secondly, Biddy, if we can ask you to put on your camera again, sorry please there just for a moment. Biddy O'Neill as well is coming up, and Biddy of course is there, and she's been very much a champion on the island of Ireland in relation to men's health, part of the Department of Health. She's been part of the first pieces of research, the National Men's Health Policy. She was very involved as well in the Healthy Workplace Framework. So much of our work has been dedicated to men's health. So Biddy, it's fantastic you're here with us today. Thank you very, very much as well. And then we've Paul Gillen. I'm going to ask Paul to come up for a moment. And Paul is from out west. And I don't mean Colorado, I mean out past Galway. And Paul has been very involved as well on the island of Ireland in relation to men's health and well-being. He's one of our national trainers in relation to the National Men's Health Programme that we have. And he's going to be talking with us in a few moments as well in relation to, I suppose, Men on the Move, which is a programme that's really worth knowing about. So Paul, thank you very, very much in relation to that. So the way we're going to proceed, as I say, I'm going to invite, first of all, I suppose, Noel, if he's ready to come up and join us in a few moments' time. And he's going to prepare his slides. And Noel is going to, first of all, introduce to us the idea of why men's health. And it's a really good starting point in relation to the first in the series of webinars. So Noel, thank you very much for being with us. And please bring us into the why of men's health.
Thank you, Lorcan, and thank you for guiding us in so skillfully into to today's webinar. Good afternoon, everyone, and thanks very much for taking the time to join us. I just wanted to say at the outset, I got my first COVID vaccination yesterday. So there's an extra pep in my step today. I'm delighted to have got it. I just thought it was best to mention it in case I start behaving erratically or if I break into Swahili or something, but I jest, of course, in relation to that. I'm going to share my slides here now. Just bear with me for a second. Great, so I think we're good to go. So the focus of today's webinar, Why Men's Health, is one of the first questions we address as part of our Engaged National Men's Health Training Programme that Lorcan mentioned there. And it generates quite a range of responses. But I think the common denominator underpinning these responses is generally a sense of wanting to do right by men, that sense of compassion and duty of care to seek better health outcomes and better lives for men. So I think a really important message from the outset of today's webinar is that men's health matters in its own right and that it's not about positioning it against women's or children's health. Okay, so I'm going to dive straight in. I'm going to propose that there are four main arguments about having a rationale for men's health. And the first of these is to consider this notion of inequalities or inequities. And these are quite complex concepts, so I'm going to try and explain them as simply as I can in 60 seconds. Okay, so when I started this work almost 20 years ago, this is one of the first reports I came across from the Institute of Public Health. And it was quite controversial, and you'd argue still is controversial, because for the first time there was a mention of inequalities and men in the same sentence. Because traditionally we were used to hearing about patriarchal dividend, that men enjoyed a benefit compared to women across all sorts of measures and areas. So to position men's health in the context of health inequalities was quite contentious. And if we look at 20 years on, some of the kind of rationale for this is a slide from the World Health Organization. And again, I don't want to baffle you with science here too much, but if you look at the red dots are premature mortality for women across the EU member states, working from the left-hand side, which is the most well-off countries, to the right-hand side, the least well-off countries. And I guess the first thing to note is that in all countries, premature mortality is higher in men than in women. But that doesn't quite tell the full story, because if you look at the red line, premature mortality goes up between well-off and less well-off countries, but in a quite a gradual way. But critically, if you look at the blue line, when you move from well-off countries to less well-off countries, the slope of the line is much more dramatic. So in other words, men from disadvantaged and from lower socioeconomic groups seem to experience much disproportionate and adverse health outcomes compared to men from less well-off countries. And the gap is much higher between more well-off men and less well-off men than it is between more well-off women and less well-off women. Similarly, if we turn to an Irish context, and this is a really good report that came out just before Christmas from the Men's Health Forum in Ireland, we see that, yes, there's a difference in life expectancy between males and females, but the difference has been decreasing over the recent years. And in fact, when we look at men on the left-hand side of the slide, when we look at life expectancy for men in the most deprived areas compared to the least deprived areas, the gap between men in those two groups is actually higher than the gap between males and females. So in summary then, what I'm saying here is that while a focus on overall or categorical differences or inequalities, if you like, between men and women can be considered a valid starting point, it inevitably results in what you might call a competing victims or them versus us debates. But more importantly though, it masks really important differences between different population groups of men. So the real question ought to be, how do sex and gender differences intersect with the broader social determinants of health? So things like race, ethnicity, social class, housing, etc. And how do these intersections result in significantly worse health outcomes within male population subgroups as distinct from comparing men and women? So this is kind of more for the next series of the next two webinars. But if you look at it from the point of view of inequities or health equities, we need to shift the focus from health inequalities, where the focus is on treating everyone the same, to a focus on health inequities, where the focus is on recognizing that different groups have different needs. And this is definitely the way forward, I think. So the challenge for all of us is, how do we target services and resources to those most in need? And again, as I said, these are questions that we will pick up in the next webinar. And it's also worth noting that the notions of equity and fairness are embedded in the Healthy Ireland framework. So this isn't me just saying it, it's part of our national strategy. And notably, Article 41 of the Constitution also talks about equality in the context of due regard to differences. Okay, so that's the first argument. The second argument is and Lorcan has touched on this already, is the notion of gender and masculinities. And in my time working in this area, there's been an explosion of writings, both in academic and popular literature, about masculinities. And very often the focus is on the notion of a crisis. We hear about toxic masculinities. And the general undercurrent to this is that men have somehow lost their way in society, or are feeling kind of a loss of identity, a loss of sense of purpose, a loss of sense of role, and that this notion of crisis is the predominant theme. And it's interesting, you know, on one level, the scale and rate of change in terms of gendered identities and roles has been stark. I mean, with 50 years ago, who could seriously have envisioned there being a gay Taoiseach and marriage equality in Ireland? You know, if you would pitch that in the 1960s or 1970s, I don't think many people would have deemed it in any way possible. So on one level, there's been dramatic and massive change in relation to gender norms, gender identities, masculinities, a lot of which has been really positive, I think. But it has also posed challenges to men's sense of purpose, identity, role, for certain men groups as well. So there's both pros and cons to this. And if we consider masculinities in the context of health, traditionally, more kind of, if you like, traditional notions of masculinity have been associated with men not going to the doctor, say, promptly, with more kind of adverse health behaviors such as alcohol and smoking, with men not being kind of realistic about their perceived level of health or weight, as we see there in the top left-hand corner. And also the notions of masculinity have weaved their way into promotional campaigns, especially by the tobacco and drinks industry, that associate their products with more kind of desirable forms of masculinity. So the Marlborough ad is a classic one there. There was also a sponsor of the All Ireland Hurling Series. I won't mention names for obvious reasons, but it framed masculinities in the context of men as giants. So these notions of traditional or kind of dominant displays of masculinity are very much embedded in culture and in the institutions in which men live, work, and play. And they can be really hard to kind of break down or challenge. So these notions of traditional masculinity is still very prevalent. And when it comes to kind of looking at the impact of this in terms of men and vulnerability, I think it's really, really considerable. This is a quote from Michael Harding, the writer, and I'll let you read that in your own time there, but he talks about the challenge of facing up to health issues. And I think the last line is what's really significant here. It was the horror of appearing vulnerable that really was the kind of real challenge for him. So this is something that being vulnerable is often seen as opposite to more traditional notions of masculinity. So when it comes to owning up, as it were, to having a health issue, particularly in relation to mental health, this can be particularly challenging. And in my own experience, and apologies for those of you who've seen this slide before, this is a slide I used to describe my own kind of battles with acknowledging vulnerability as I have adapted to making the transition from, I've adapted to a Parkinson's diagnosis over the last 10 years. And my key learning has been about making the transition from always trying to be the frog in the middle, perfectly balanced on a precarious, overcrowded branch, to being the frog on the left, hanging on and terrified, to eventually being the frog on the right, accepting that I can't be that frog in the middle, but making the most of trying to get back up on the branch as much as possible. So if you've lost me on that, I'll just blame the Pfizer vaccine, I think. Okay, so the final couple of arguments, and these will be more brief because I'm just conscious of time. The third argument is the economic argument. And there's a whole literature on the importance of a healthy male workforce and a female workforce, obviously making good economic sense. And there's lots of workplace health promotion and public health interventions that seek to promote the health of workers. So this is a well-established argument, but it's particularly important in the context of our aging population. And again, this is from the Men's Health and Numbers report that I mentioned earlier. So I won't bore you with too much of the details, but the projections over the next 20, 30, 40 years are that a huge proportion of the population will be over retirement age. So it's imperative that those workers or those people who retire maintain good health, because otherwise the pressure on our health systems will be stark. So from an economic point of view, a healthy male and female workforce makes perfect economic sense, but also from the point of view of future projections of an aging population, it's really important. I think it's a key to balance this argument with the last argument, which is the what could be more important argument. And I think this is really important. And my concern in this work is that for far too many men come to this realization too late in life. So I mean, your health is your wealth. So not kind of pushing that aside until you get into, say, middle age or into retirement years is not the time to start considering that. The time to start considering that is with boys and with young men, and taking steps to ensure that you enjoy the best health possible. And as I said, my concern in this work over the last 20 years is that far too many men come to this realization too late in life. And all our efforts need to be directed at supporting boys and men to figure this out for themselves. And finally, I think my greatest learning in this work over the last number of years has been in discovering how to care for and nurture others. We learn to care for and nurture ourselves. So I think that's a really important message. So to sum up then, the four arguments that I'm positioning or putting forward today are: We need to look beyond binary sex differences, men versus women, to impact the nuances of health inequalities between different groups of men. So it's not enough just to position men's health as being an inequality issue. We need to target different subpopulations of population groups of men who experience disproportionate adverse health outcomes. Secondly, we need to understand how masculinities influence men's health practices and are shaped by dynamic cultural and environmental factors. So it's not enough to say that men shouldn't smoke or men shouldn't drink or men shouldn't do this or that. We need to understand the context of the behaviors and how attitudes are formed and entrenched in cultural and environmental contexts, and that in order to change behaviors, we also need to look at the cultural and environmental context. Thirdly, promoting men's health makes good economic sense. That's a given. But we also need to consider that in the context of an aging population and getting as many people healthy into older ages as possible. And finally, then, men's health is men's wealth. And without health, we have nothing at all. So thank you very much.
Well, thank you so much for that really informed and informing insight into the why of men's health. It's really, really clear to give us that both professional and actual personal insight into it. And we're going to be returning to that. Paul's going to be here with us in a minute. He's there on screen. But before we even go there, as Noel has already said in that really insightful presentation, this is the first in the series of 4. And just to remind us all of that. And later on, we're going to have Fergal will come on. Fergal Fox is here with us today, very much an architect of part of the 4 series that we put in place here. And he will be telling us more about that in relation to where we'll be going next, because not all of these things can be discussed today. But thanks very much for that. Paul Gillen, as I was saying earlier, is very much part of the work that we've done on the island of Ireland as well. And that's really great that you're here with us today, Paul, and that you can share with us and give us a lens now that's going to look in at, especially, I suppose, the men on the move. It's all yours, Paul. So really looking forward to hearing about this initiative that's been very successful.
Thank you very much, Lorcan. Good afternoon, everyone. I'm delighted to be here with you today to tell you about the Men on the Move program. So I'm just going to share my screen, if that's okay. Just give me 1 second.
So, there now, Paul.
We should have fun. Good afternoon, folks. I'm delighted to be able to talk to you today about the Men on the Move program. It's a community-based physical activity program that we started in 2011, and it has grown from strength to strength then. The type of program really that we wanted to develop was to target middle-aged men, inactive middle-aged men, and we wanted to introduce a program that was different. There were a lot of competitive type programs out there. We really wanted to introduce a program that was a bit different. The context for it, I suppose, as well, and this is, I suppose, to follow Noel, why do we kind of try to engage with men, and why should we engage with men? At the time, there were a lot of European reports and a lot of reports out there saying that men were engaging in fewer opportunities for physical activity. They were not meeting the recommendations around physical activity. There was a combination of a growth in urbanization and mechanization of technology, and all of that led to kind of an increase in sedentary lifestyles, and obviously then a 5-fold increase in obesity. So that was the context as well. And you have to think of men as well. We were still in the grip of the 2008 crash. You know, sort of when the Lehman Brothers collapsed, whatever like that, they sent shockwaves all around the world or whatever, and Ireland was no different. There were jobs were lost, money was not easy to be had or whatever, the mood in the country was low. So there was a yearning for connection and a yearning for men to actually connect. So this is why we developed the program. And when I say we, it wasn't really me, it was my colleague Kelma Baran in health promotion and Lawrence Gahan in health and wellbeing in Mayo, developed this program where they wanted to target middle-aged inactive men, so through a range of activities where they would engage in walking or jogging or whatever like that, but also about increasing their awareness about the importance of physical activity for all aspects of health. And who better to approach only the Mayo Local Sports Partnership, who had a really strong record around promoting sport and physical activity right around the county. So collectively then we set up 3 kind of pilot areas or whatever in Ballina, Claremorris and Westport. And we felt that if they went really well there, we were going to roll this out across the county of Mayo. So what we did was we actually said about that, but we recruited physical activity leaders in each of those centres. And these guys were really, really pivotal, because these guys would have set the tone in terms of the organisation, the content and the organisation of the programme. Because these leaders were meeting the men twice a week for 8 weeks. And these guys would have set the atmosphere, they would have set the appeal, they would have set the social setting for the men. And they made the men feel comfortable. They made them feel part of a group. And that brought the men back every week. They brought a sense of laughter, of banter, and of fun to the whole thing or whatever. So men felt right at home. They felt part of a group or whatever. And they got texts if they didn't turn up or whatever. So each week like that, the rate of attrition was low. Men attended each week. And what better way to actually sort of do this program as well than running in sort of on beaches, on trails, on the greenways, beautiful physical activity, natural physical activity supports that are there in Mayo. So then once we had to sit down and think about, right, how are we going to attract men into this? Because we kind of thought, well, men won't engage, they won't turn up, whatever. So basically we kind of said, right, let's have an information evening and let's bring together really good speakers who will kind of attract the men, who will demystify the program and make it easy for them. So we had James Horan, who was the Mayo football manager at the time, he spoke. And of course, Charlie spoke as well, who is well known in Mayo circles in terms of his sport or whatever. And I was asked to speak as well to bring down the tone. But anyway, we did that anyway. And we also threw in the idea of a free health check, which was a hook to engage the men. Critical too as well, we wanted to develop kind of a poster campaign that was attractive, and similarly with the title. The title needed to have appeal, a broad appeal that would say men could kind of be drawn to it. What was critical too was like that, and Charlie's contacts were brilliant here like that. He would have spoken to the community groups, to the community welfare offices, to the sports groups, community organisations, to get referrals from those. And we built up a fabulous relationship with the Midwest Radio. Tommy Martin is a DJ in Midwest Radio. I'm not sure if you're familiar with him, but he has a huge listenership. And Tommy was great in terms of interviewing us and advertising the program week on week. And we built up quite a substantial kind of media PR piece around it. So that was hugely important. The programs we developed, there's one sample program. Again, it's refreshing, it's inviting or whatever. The Men on the Move is inviting, and nice and colourful. And similarly with the leaflet, and you can see here the three locations, the times of the information evening and so on or whatever, and a brief description of what might happen at those information evenings. So that was that. What was critical too, and intriguing about the people who actually turned up, were the numbers of men who actually turned up each night and the numbers who actually signed up for the program. We actually thought maybe that they might be attractive to young people, young fit people, but no, it wasn't. These were ordinary men. Why focus on men was the question. These were ordinary men who wanted to put their hand up for help, for support, for a sense of belonging. Why? Because they had blood pressure problems, they had weight problems, they had truncal issues or whatever in terms of their fat. They were not happy with their health, low energy levels, eating the wrong type of foods. These were guys who were probably suffering a bit. Again, that crash we were still in the midst of that crash or whatever, and the mood was low in the country. So they wanted a connection, they wanted to socialize as well as improve their health. We had 107 men there. I'm not sure if you can see it there between the three towns or whatever who actually subscribed to the program. Part of the program as well, which is critical, and we all know that it's not my favorite piece, of the evaluation, but it's important in terms of, you know, establishing the effectiveness of the program, particularly because we were going to roll it out across the county. We needed to make sure it worked. So we had kind of a couple of times of data or evaluation data. We've health screening, which was waist circumference, the body mass index test, and a fitness test. We also had kind of questionnaires that we gave out, looking at demographics and personal information, and then lifestyle behaviors. And then post program, we wanted to actually talk to the men. So we had interviews and focus groups. And I'll chat a little bit about those later. So we introduced those at 5 kind of phases. Number 1 at the start, then after the first 8 weeks. I forgot to say, after the first 8 weeks, the 8 men, or the men did not want to see the actual demise of the program. They said, we're not going anywhere. We want you to put it on again. So they put it on for another 8 weeks. So after the 16 weeks, we did the screening again. And then we had the focus groups at week 20, which was 5 months after the start of the program. And we had at week 24, then we had telephone interviews. So that was the evaluation data. In terms of the information needing, the quantitative data, like that was important to establish at the start, just to see where people were at in terms of a baseline. Again, we had the speakers, we demystified the program, we engaged with the men, we wanted them to kind of get a good sense of the program, and we had free health checks there, which was always attractive to engage men. And we had our public health nurses and practice nurses who would have taken the bloods, the body mass index, the waist circumference stuff. And they would have given appropriate advice. And each man got a report card. And you know what? The men felt heard, felt listened to. And they had a barometer now. They saw where they were. And now they could see, well, wait, now maybe here's a program that can help me improve. If people were referred or needed to be referred to a GP, that was done. So this screening, that I just spoke about, that happened at the start, at the end of the first 8 weeks and the end of the second 8 weeks. Part of that obviously was to see their fitness level and how fit they were. So obviously like that, we kind of did that, sort of in the 3 centres. Men could either walk or jog the mile that they had to do or whatever. Now invariably, you might think, hold on, this is men, this is going to be too competitive. But in fact, it wasn't. Men supported each other. They were there for each other. They clapped each other. There was a real sense of everybody's on a personal journey here. And we all knew it. So it didn't matter where you came and what your time was. And we did that, the mile test at the start of the program, end of the first 8 weeks and the end of the second 8 weeks. And we did it to military precision. Charlie tugged out in the combats and boots, and by God, we did it in military precision, as you can see there. The other thing that was important too, folks, we did the questionnaires as well, just to capture the piece around demographics and lifestyle behaviors in terms of physical health, mental health, sleep patterns, social health, all of that kind of stuff, because that's really important to actually capture as well. And then lastly, the qualitative data. This is where at the post-program, at the end of the program, we had interviews and focus groups in each of the centres or whatever, because we wanted to hear from the men as opposed to looking at data and figures. We wanted to hear how effective it was for them. How was it in terms of your behavior change? Did it make an impact? And we asked them, we wanted to know in terms of future design of programs, what motivated you to come? What were the things about the program that you liked? What appealed to you? What would we redesign? If we were to redesign this program or do it again, what would we do? So that was important. And Paula Carr did that for us. And the men really loved the way she conducted the interviews. It was full of experience. So the impact, like when you think of the impact of these were ordinary men or whatever like that, and when you think of it, the quantitative data, physical fitness is the one key thing that correlates with longevity. And if you see here, 60% of men improved their fitness, some by 15%, some by 30%, and some by over 30%. In terms of truncal fat, which is huge for men, we got that down from 66% of men who were high risk down to 43% at the end of the 16 weeks. In terms of sedentary behavior, we increased that hugely. In terms of people who were active, that went up from 23% up to, I think, 44%. Good health and self-rated health, that went up. Again, post-program, sedentary behavior went down to 4%, I think, post-program. Energy levels went up. So these were real kind of strong, good results after a 16-week program. Unfortunately, alcohol increased and the diet didn't change too much. But again, I often think maybe that was because men were carrying a load. They were dealing with issues around the job, access to money, stress and so on and so forth. The physical activity was the one thing that kept them going. The one thing I do want to say is that there were a lot of personal stories that were hugely important here, like that. Why? We were getting emails from wives telling us that they were living with a different man. And it wasn't because they found a new partner where the man was out running. It was because he was more productive around the house. He had more energy with the kids. It was absolutely brilliant. We had stories where men who were inactive before started walking and then started running marathons. Really good stories. We had, again, because of the evaluation or whatever, it really went well. So Charlie and his team set up this program in 7 more locations, which meant that men and their families in 10 locations around Mayo now were able to avail and reap the benefits of something that's quite simple. Following the evaluation as well, like that or whatever, like that, we pitched it to Nazi Eldon at the time or whatever, and we were successful in getting 130,000, which meant that we were able to develop the program with the national team, Lorcan, Noel, Paula, Finian, Colin. We were able to develop this nationally in 8 counties, which meant the reach multiplied and multiplied and multiplied. Why focus on men? Because it worked. This was after the 16 weeks. This was where the men ran 5K, their families and kids came along, and to see their faces as they crossed the line, again, it wasn't a bit competitive. The men ran together, you can see the joviality, you can see the numbers of men that completed the program. It was a real sense of achievement, and that's what it was important. Were there secret ingredients? No. I think what really works about this program is the simplicity of approach, no cost. All they wanted was runners, needed was runners. The social outlet was pivotal, and where men could meet and have the crack and a banter was pivotal. And I said that again about the physical activity leaders. They massage that all the time. This program is easily transferable, and Charlie did that, and subsequently we did that in other counties to every town and village that needed it. Great partnership, we cannot underestimate that, between health promotion, between Lawrence Gahan in health and wellbeing, and the Mayo Sports Partnership. Fantastic crew to work with. We even made the 9 o'clock news. We got a minute and a half with Pat McGrath one night, which was absolutely fantastic, or whatever, where men spoke about it. And it was about that, hearing their personal stories. It really it was a spark that maybe kind of ignited some other programs in terms of physical activity. So I want to thank you folks for listening to me. I hope you enjoyed it. But now I'm just going to actually ask you to just bear with us. We're now going to show you a program that started in Waterford subsequently, and the video clip is called Through the Eyes of Men, and you'll hear it from the men themselves in terms of how they felt the program went. Thank you very much, folks, for your time.
My name's Pete Jones. I work with the Waterford Sports Partnership, which is a subsidiary of Sport Island. Basically, we are coordinating the Men on the Move programme for everybody in County Waterford, and we deliver this programme in a number of locations throughout the city and the county.
The Men on the Move programme gets guys out, gets them training, gets them meeting other men, just having a good crack, and they can improve their fitness, and it works for all levels of fitness.
When I heard that this programme was about to take place, I was pretty interested, because a lot of the time men's health is not thought of that much. Women are much better getting into groups, and so I was adamant that I was actually going to be part of it, and I tried to bring some of my friends along as well.
I think the biggest thing that kind of gets guys coming back each week is just the laugh we have, really. It's a great social aspect where we're always out walking, no matter what we're doing, no matter what venue we pick, we're always having a crack. Rain, hail, whatever we're in, there's always a bit of fun. Guys are chatting about it. Current events, stories from the weekend, whatever happens, it's a bit of fun. And then we're getting active while we're doing it, so you wouldn't even see the hour fly by.
I suppose the reason I got involved in men's booth, I saw it advertised, but before it came along, I was a couch potato. I was over 16 stone, I was on diabetes medication, I was on high cholesterol, high blood pressure medication, and I was struggling to go up the stairs. And after the first 6 weeks, instead of struggling to walk up the stairs, I was running up and down the stairs.
Well, I felt initially I definitely was overweight, and I wasn't anywhere near fit enough or anything, so I just needed to lose a few pounds and just get fitter, and it seemed an ideal opportunity.
The lads are feeling happier, they're going out and doing more, and yeah, they might have lost some weight, but what other than, they just got more energy, they're happier in themselves, they've got their zest for life back. And it's great to see a difference in lads from our youngest lad is 22, our oldest lad has been into their mid-60s, so it's great that everybody just comes together as men, and instead of meeting in the pub and having a pint, like, we'll actually meet up, have a chat, and we'll go for a walk. And so basically we're kind of, social and mental health is making sure that physical health is at the forefront as well.
And just an hour a week that I just forget about everything. Right, just clears the head completely. So from a mental health point of view, it's brilliant, because it brings you back. You forget about all the worries or all the things at the office are, and you start from scratch. And that's what I find absolutely brilliant. Apart from, like, I wouldn't go out, I don't go out drinking, or I don't go, so I wouldn't, so I meet a bunch of guys and we get to be good friends and we have a chat, and we might talk about things that we wouldn't normally talk about, kind of health things and that sort of thing. So it's brilliant, that's really why.
We've done 14 programmes, and even for those 14 programmes, we've changed it. We've evolved as a programmes which would adapt to what the men want, and that's the key thing, making sure we talk to them and we find out what they want.
Well done, Paul Gillen. That was absolutely excellent. I can hear your passion like Noel before you, and to see it in action in relation to that video is just absolutely super as well. A very enlivening celebration of men getting involved and doing something, a really, really good initiative. It's our hope, folks, across these series of webinars that we will bring you and focus on the practice experience of initiatives that have worked well in relation to engaging with us as men for our health. And it's just, I like that idea that Paul had mentioned there, the simplicity of approach sometimes is finding the hook that can really reach out and be a support to us. So look, I'm going to ask, please, the panel who are going to join me here now. We have not a long time, but I'm going to ask, please, for Noel especially, and for Paul, and for Biddy, if they would come on. I think they're on there now with me. So it would be great to have us on camera. And we're going to start maybe with some of the questions as well. And just to say as well, folks, if there are questions and answers is there, that's it's there as well. There's our Paul coming on. Is Noel there as well? We're all coming on together. Thanks very much. And Biddy, I don't see Biddy there. There's our Biddy now. Thank you very much for joining us. That was really informative and informing, Paul and Noel. And Biddy, again, thank you for joining us here on the panel for what's a short time to ask a few questions. But look, can I begin? We've said before, this is the first in a series. And I'm really interested to ask the question. Maybe people are interested there because I can hear the passion in people's voices when they're talking about it. And I know yours as well, Biddy, in relation to getting involved in men's health. Just very briefly, very, very briefly, Paul, your own passion for the work, getting involved. For yourself, what was it really drew you into men's health? Very, very briefly. What is it you love?
I suppose it was by default, really. I was appointed in the HSE as a physical activity coordinator or whatever, but as soon as we came into the HSE or into the health board at the time, you were given a group, and I was fortunate enough to get men's health at the time. Now, it was difficult back in 2000. I joined the HSE in 2000 or whatever. It was difficult. The men were difficult enough to engage with at the time or whatever. So it was a tough enough to crack. So we had to come up with novel ways and of actually engaging with men. So we kind of started working with things that were established, local community groups, active retirement groups, community gardens, that kind of stuff. And believe it or not, once we got to know the men and the men built the rapport with us, we were able to develop the sheds in later years and so on.
Very good. And Biddy, the same question for yourself. You've been championing for a long time. Getting inside men's health seems like a long time ago. It's the first piece of research, but you know, your first instinct, what drew you in there, just very briefly?
Well, I suppose at the time, I think Larkin actually, it was it had been identified in national as a priority issue, men's health. And then I was working in the southeast at the time and had some involvement with the Men's Development Network, which was up and running. And so there was a connection there. And initially, I think we had a workshop, and it was so stark at that time to look at the differences between men and women and in terms of their health. And that was the catalyst that kind of initially got us going and got the research going. And then we were so fortunate to get Noel and Paul and Carol subsequently. And really then our partnership working with yourselves really supported that and all that evolved from there. So it just seemed there had been a lot of focus that time in the early 2000s on women's health, and that there was a serious gap from men's health. So we were really fortunate to get supported and really then get, you know, leaders and get so many passionate people. I mean, you know, just listening to Noel there and the story over the years really was touching in terms of where we've come from and how it's evolved.
Yeah, and can I go to Noel then, because that's really good introduction to Noel. In relation to Noel, you as well, you've come in from the Getting Inside Men's Health, and you were there up along then through the national policy and launches. Your own passion for coming in as well. I mean, it wasn't your first piece of work. You woke up and you wanted to say and see something about men's health. Where did it come from as well? Just very briefly.
Well, I think I was always kind of curious and struck by what I'd call the kind of fatalistic attitude that a lot of men had. And I turned to my own father, uncles. Like my favorite uncle was Uncle Mick. He lived in Limerick City and used to come out to our farm weekly fishing and hunting and all that. And he died at 53 and left, you know, a family of 7. So as I got older, I reflected on that, and you know, it's easy to look at the statistics at a European or national level, but all of those statistics kind of drill down to families, to fathers, to brothers, to husbands, you know, and so on. So that sense of loss and that sense of trying to do something that might challenge the status quo and the culture that told men that this was inevitable, and that poor health outcomes were inevitable. So I think that's what drew me in, really, Larkin. Yeah.
No, stay with me. There's a lot of people who are online today, and we're going to come to that, as I say, not just today, but even across the series, in relation to engaging with men, people doing in organizations doing really, really good work. You put 4 lenses there today on the why of men's health. It's a starting block, and really it shows that it's very nuanced. It's not just one single thing. So when you started in the work, did you think it would be so nuanced that you would be mentioning 4 really clear lenses that we need to go in at in relation to men's health and well-being?
I think we've learned a lot over the last number of years, especially in the last 5 years. I mean, I'm really struck by the talented researchers that are currently involved. I mean, our output now on the international stage through our masters and PhD students is really, really good and really strong. So, we're learning a lot from that. And that kind of evidence base. Billy has always talked about this, that the links between the kind of research academic sectors, the practitioners, the policymakers. Ireland is a small place and we've worked really effectively. So like we're still learning all the time. Every study that starts brings something new and different and challenging. And I've always been one to think about things as more complex than simple or straightforward. I think if we get to a point where we think we've figured everything out, all it means is we're not asking the right questions.
Okay, we're going to explore some of those lenses as well as we go through the other.
It's all about continuing to ask questions. That's what I think the secret is. Yeah.
Yeah, and Biddy, if I can just come to you in relation to what Noel has said, you are very much part of saying if we're going to do this, it has to be done with evidence, and the importance of that, as you've seen, that's really been important.
Oh, absolutely, and I mean, everybody's tired of me saying it, but I think what has created the success and the energy we have around men's health is that partnership. And the reality was, when we launched the men's health framework, we were hitting recession and there was no resources and there was no support. And, we were forced to actually look at what have we got, who can we pull into this? So there was the likes of Paul in the West and there was Finian in another board. We had very few people. So we had to work really closely with yourselves and with the forum and with the researchers. So it was that piece of really coming together with a group of passionate people and see what can we actually do in a meaningful way. And I think it has evolved into what Noel has just described there, a really, really sound evidence base, really good practice, and really good models to keep moving forward on.
Paul Gillen demonstrated, I think, for us there a while ago, the link between practice and policy and research. Paul, when you're out in the field and you're working, and again, the evidence behind what you mentioned, that the evidence was really important, but the actual practice and practicality of getting in and working with men then, from what Noel and Biddy have said around learning of getting in there, what has been the delight that's in you in relation to discovering what works? Say a little bit about that, just briefly as well. When you link about that, the practice, the evidence, and then you find something, how important is that the evidence base that pins that down to be able to say, then we can roll this out?
Well, I think something that's probably quite important is your own value base kind of initially. I think if you can approach working with men from a positive perspective, as opposed to seeing them as a problem or an issue, the men don't listen, they're hard to engage with. But if you approach kind of working with men from a positive perspective, see them as people that are like all humans. They're yearning for connection. They're learning to be to be supported. And so I think if you can approach men and working with men from that kind of a value base, it's always very, very important. And maybe the reason is why they don't, go to the doctor, or they ignore symptoms. Maybe it's because there's a sense of fear there. And I think if you kind of can come to men and break down some of those barriers by building a rapport, by building a sense of trust between you and them, men will work with you if the program is appropriate and if the approach is right. That's my general sense of it. And I've seen it with the Farmers of Hearts, I've seen it with the Sheds, I've seen it with community gardens, I've seen it with Raising Boys with Fathers. You can see it with fathers. Men might not often do something for themselves, but if it impacts on a son or a daughter, they would engage, like that. They attended Raising Boys for Fathers programs in their scores because they knew it was important for their kids' development. But I think the tide is turning now, and now they're looking at health and engaging in health as important for their own development.
And tell me then, Noel, in relation to what Paul has just said as well, you know, when you were speaking, you were putting 4 lenses on, you know, the engagements with men. And you said very clearly, we have to be really open and looking into the diversities of masculinities. So there's not just one type of man and there's just not one type of engagement or program. So speak to me about that for a moment.
Yeah, like, and this speaks to kind of effective engagement as well with men. So I think a key starting point is always to approach like a target group. Like, say, if you take Paul's work there with how they started Men the Move, they didn't come up with a program like from a book or from the internet. They went to the local community and they engaged with the local community. They consulted, they asked questions, they worked with the men and with community groups in a partnership model that Biddy spoke about. So and then they rolled out the program in partnership. So from a sustainability point of view, this worked. So to go back to the diversity piece, like every group is different. There's another program that Paul mentioned in Sheds called Sheds for Life. You know, where it doesn't, it's a health promotion program that has got core component parts, but it's fluid and diverse at the same time to meet the needs of different men's shed members in different parts of the country, and to allow ownership of men to take, you know, to adopt the program for their own needs. So I think it's critically important that to understand masculinities as something that's not fixed in as character types in men, but rather like in terms of configurations of practice that are constantly shifting and changing. And this is why it gets challenging. You know, it's much easier to have like a template there that you always go out and apply. But the much more challenging piece is to actually recognize that diversity, to work with it, work with men, and not see it as kind of fixed, as I said.
I'm just conscious of the time, folks. It's really flying for us today because we've had a lot that's been in the hour for us. But I suppose maybe, can I stay with Noel and maybe come back to everybody around this one just for a moment? There's people asking questions. We're going to have to carry them over, I think, into other sessions as well. But if you were to think, maybe if you had a wish list in relation to a targeted wish list in relation to what are the key things we need to be doing then in relation to the why of men's health and engaging people in the why and supporting others to be reflective in relation to that. Noel, can I stay with you for a moment, just briefly on that? What do you think are the really key things to keep in mind?
I'd say 2 things, Larkin. I'd say continue to invest in capacity building measures that support the workforce to engage effectively with men. And that's our Engage program. Again, no more than masculinities, it's something that has evolved to cater for the needs of different groups. The most recent version of it, for example, is working with Teagasc and agricultural consultants to engage with farmers and health. So that capacity building piece is really important. And as I mentioned earlier, and I would be biased in this regard, but I think I'd love to see more funding of the scale up of of these evidence-based programs that are coming through, programs like Sheds for Life, Farmers of Hearts, Men in the Move, and lots of others that are coming through the pipeline as well. So, you know, we're producing good evidence in relation to these. So I'd strongly encourage the HSE and others to put as much resources as possible into funding them. Yeah.
Okay, and Biddy, would you like to add to that briefly? What do you think?
Yeah, I suppose for me, one of the learnings over the years is going to where men are at. So, you know, whether it's the workplace, whether it's on the farm or, you know, the Farmers at Hearts, went into the marts. And really then, I suppose, based on what Noel said, is looking at what their needs are and recognizing that men of different ages have different needs and different priorities, and one size doesn't fit all. So it's kind of continuing to build the evidence base, but also, as Noel said, to really try and secure more funding to drive the implementation.
Okay, and just before we bring Fergal in to join us in a moment, Fergal, you can join us there if you wish, Fergal, come in now with your camera. Paul, yourself as a practitioner, you know, listening to Biddy and Noel, you know, finding the hook, different groups of men. For yourself, what do you think is the targeted piece, the next piece in relation as a practitioner?
For me, I would love to be able to support young men to be strong enough and to be self-confident enough not to have to prove their masculinity all the time. Because unfortunately, it's always done in adversely in terms of their health or whatever. That would be one thing. And also, I would love to continue, because I know that there's been a huge shift in terms of, you know, the healthcare professionals and people working with men they're all adopting, or tend to be adopting now, a gendered kind of approach to working with men. And that's hugely important, to allow men to engage, to allow men to feel heard, and to allow men to access the services. And they're doing that now because of that shift.
Thank you very much. And thank you, Biddy, and thank you, Noel and Paul. And thank you, everybody, for participating today. You can hear the energy and I hope the passion that's going to be part of this conversation as we go forward. And Fergal, thank you very much for joining us and coming in. And we give you the floor, please. You know, you've been so much part of the work as well. You're one of the architects of this piece of work we're on today. And you've been so much at the heart of men's health on the island as well. So please do tell us more.
Thanks a million, Lorcan. I just want to highlight, I suppose, from HSE Health and Wellbeing, my role. Sorry, I'm muted there. Sorry. My role is around stakeholder engagement and communications, but chairing the Men's Health Advisory Group, implementing the HSE Action Plan, Healthy Ireland Men. I suppose it's been very rewarding to see so many partners come together. Noel mentioned the Sheds for Life. We hope to be able to tell you a lot more detail on the Sheds for Life, because we'll be the Irish Men's Sheds Association will be hopefully launching something on that in the coming months. So we hope to be able to tell you a bit more about that during Men's Health Week, when our next webinar will be on. We hope to be able to tell you more about our farmers' health and wellbeing initiatives in September, when we hope to have something out on our Farmers of Hearts initiative. And we also have on firm ground the training of agricultural advisors. So these are guys going into the farms, working with farmers. Some of them are funded by the Department of Agriculture through Chaga, some of them are independent advisors. And they're coming to us and we're giving them a version of our Men's Health Engaged training program. And there's been an awful lot of work put into the design of that. And that's going to be delivered online in June, please God, everything going well. So we're looking forward to being able to tell you a bit more about that in September. We were very impressed, I suppose, with the engagement that we got on the first Men's Health webinar we did on International Men's Day last November on men's mental health, in response to, I suppose, the impact of COVID on men's mental health. And we had inputs that day from men that were in sheds, young men through a Spun Out video, Spun Out website. Spun Out helped us put that together. And we had an input from a farmer about the impact on them. So that was very engaging. We have that webinar up on our HSE Health and Wellbeing YouTube channel for anybody that's interested. I suppose the why men's health for me, you know, other than being, you know, working, having a remit in it in HSE Health and Wellbeing at the moment, my job coming into the health service was working with Traveller Men around health promotion. I came in a little after Paul Gillen, and I had the likes of Paul and Noel and the Men's Health Forum to kind of seek advice from. And while I'd worked with kind of disadvantaged men beforehand in either, you know, young men in care or men in kind of drug rehab or common ex-offenders, if you like, I did kind of short stints in a lot of projects around those areas, and inevitably there was more men in those services than there was women. But when I came to work with Traveller Men, that was really stark about, I suppose, the impact of discrimination and all the multiple layers of social exclusion that they were experiencing. So I think, you know, as Noel mentioned there, some groups have it a lot better than others, and some men are able to engage with us more easily. So there is lots of things happening. I just want to highlight a few things, I guess. The Men on the Move got a pretty good profile today, and thanks very much for Paul to doing that. I referenced Sheds for Life with the Irish Men's Sheds Association, and we'll be hearing more about that. We have Men's Health Week coming up, and we've kind of been very lucky last year. We had to put Men's Health Week online as opposed to having events which we usually have coordinated by the Men's Health Forum in Ireland. But I really encourage everybody here to utilise the opportunity of Men's Health Week and get engaged, even albeit online this year. And we'll be sending out information on how to get clued into the themes and the topics of the week. So we hope to have, we'll share some information around that. To date, the Men's Health Forum have over 90 organisations collaborating on designing that week. So I think there'll be something there for everybody. And as I said last year, even though it went online, it was a very successful week. So that gives us an opportunity of trying to push the men's health conversation nationally. The Farmers Have Hearts initiative, Noel mentioned there, and we'll be kind of hopefully slotting that into our September webinar, where we'll be also talking about on firm ground. And one of the initiatives that we have developed, but we haven't been able to deliver yet, in conjunction with the National Office for Suicide Prevention, is the Men in the Middle training on the back of the research with middle-aged men. And we hope to be, when we get out to face-to-face training, we hope to be able to deliver that more effectively. The other thing I'd just like to mention, we'll send you these signposts in a follow-up email, but we have our, I suppose, you know, today is the day of hope when you see, you know, people announcing more things about the opening up of society and opening up of the economy again in the coming weeks. And it's really positive to hear that people that you know now have got the vaccine. You know, the impact of COVID has really hit our mental health, and I'd just like to highlight the yourmentalhealth.ie website to everybody, and I'd encourage you to have a conversation around the yourmentalhealth.ie website with somebody, with a man in your life. I think that would be a positive thing. One of the mental health programs that we've been pushing since COVID is the Stress Control Online program, which starts again next Monday, and we'll share some information in the follow-up email. We also have a positive mental health video series called Mind in Your Wellbeing. And I suppose our experience is that those online supports are great, but unless a man gets a personal recommendation or a nudge in that direction, it's very, our take-up is predominantly female. So we'll to get success in engaging with men, we'll need your support on that. We have new exercise videos coming on stream in the coming weeks, which were developed for HSE staff. And I know there's a large amount of HSE staff on here today, and I really appreciate that. But anybody can access them on our website, and we have yoga, Pilates, strength and conditioning exercises, and hopefully we'll be able to do them in groups in the coming months in the summer. One of the campaigns that I'd also like to highlight, and I think we might have a slide on this that we can share, this is Bowel Cancer Awareness Month. You may have seen some radio ads about this in recent weeks, and we'll share some links to some of the articles. But again, this is something that, you know, that we kind of need support on to get it out to men and to make it normal for men to do this kind of home test. You know, if you're between 60 and 69, or if you know somebody in that age range, you can register online, and we have a free phone number there as well. So we'll share some information with you on that. But again, that's one of our campaigns, that when we want to get it to men, it doesn't just land. We really need people's help in pushing it. And again, a personal recommendation or a conversation, or slipping it into a conversation, that's really when you get some of these points across. So look, I don't want to take any more time feeding into your lunchtime. I really appreciate you coming on, listening today. We'll keep in touch with you around the upcoming webinars, and we'll send everybody, we'll advertise our invites, and just thank you all for tuning in today. Thanks very much.
Thank you, Fergal, and thank you everybody, as we've already said, for tuning in today. It's been really lovely to have this opportunity and to speak with you about the why of men's health. As we say, it is a series that will run up across into the end of the year, so we hope you can join us for the others. So thanks to my panel, thanks as well to Catherine, who was there minding us, and IMS as well. So go well all.